So today we're going to go over a young practice member. He's like 6 years old, comes in with a neurological condition, hyperactivity, mom's desperate for changes, not wanting to drug her child with medication, so she is looking at chiropractic as an opportunity for an emphasis. When we look at the spine, understand that the bones here protect nerves that control the body's function, its expression of health. So the spinal cord resides within these bones. The individual nerves exit out of these areas. If you look closely at this x-ray, there's ligament damage right here at the joint. The joint goes backwards, backwards, backwards. So this child, never being involved in an auto accident or an injury, had to have sustained an injury at a young time, most likely birth trauma. When there's subluxation or a misalignment in the spine, it puts pressure on the structures that it's supposed to protect. The structure in this gentleman is the brainstem, the spinal cord, the area of your body that controls all of the autonomic or self-regulatory functions. So to look at this from a different perspective, not to look at hyperactivity or developmental delay as a lack of medication problem, there is a neurological problem that's disconnecting the brain from the body. When we then look at another area of his body, it shows how if the neck is injured, the rest of the body will start to compensate. When the nerves are being placed irritation on, it causes problems in the muscles. The muscles then start to pull the body into an abnormal position, but it also affects the gut. And the gut is a direct communication to the brain because of its immune function. So most of your immune system resides in the gut. So if you have trauma during birth, then that leads to more susceptibility to injury, whether it's physical injury, medical injury, injury that is assumed to be chemical based. It then affects the gut, which then affects the immune system. It's a big circular area. The approach taken in here for hyperactivity is, number one, not to diagnose, label, medicate. It's to understand why it's happening and start to correct the cause, and then just watch the body starting to heal. Over a very short period, this practice member starts to focus, more attention, starts to nap again after not napping for over a year. His mom starts to see an improvement with his connection, starts to try different foods. His adaptability starts to change. All of this is through an emphasis that has nothing to do with the drug. It's simply allowing the body to express its normal state of health, which is self-healing, self-generating. If your child has a developmental delay, has a diagnosis of hyperactivity, let's embrace the improvements that can occur versus focusing only on what medication, what label, which therapist can we go to. Let's stop maintaining problems and start to correct the problem.